Hey students, this is your Nandini ma'am. Today we are going to read chapter number 6, Scapular Region, from the book B.D. Chaurasia, Human Anatomy, Volume 1. So let's get started. Introduction. The shoulder or scapular region comprises structures which are closely related to and surround the shoulder joint. For a proper understanding of the region, revise some features of the scapula and the upper end of the humerus. Surface landmarks. 1. A. The upper half of the humerus is covered on its anterior, lateral, and posterior aspects by the deltoid muscle. This muscle is triangular in shape and forms the rounded contour of the shoulder, figure 6.1. B. The greater tubercle of the humerus forms the most lateral bony point of the shoulder. Number 2. The skin covering the shoulder region is supplied by A. The lateral supraclavicular nerve over the upper half of the deltoid. B. The upper lateral cutaneous nerve of the arm over the lower half of the deltoid. C. The dorsal rami of the upper thoracic nerves over the back, that is, over the scapula. Number 3. The superficial fascia contains, in addition to some fat and cutaneous nerves, the inferior lateral part of the platysma arising from the deltoid fascia. Number 4. The deep fascia covering the deltoid sends numerous septa between its fasciculi. The subscapularis, supraspinatus, and infraspinatus fasciae provide origin to a part of the respective muscle. Muscles of the scapular region. Features. Muscles of scapular region are the deltoid, figure 6.2, the supraspinatus, the infraspinatus, the teres minor, the subscapularis, and the teres major. The other muscles are described in tables 6.1 and 6.2. The deltoid is described below. Deltoid, delta-like or triangular. Origin with features. Number 1. The anterior border and adjoining surface of the lateral one-third of the clavicle, figure 6.2. Number 2. The lateral border of the acromion process where 4 septa of origin are attached, figure 6.2. Number 3. Lower lip of the crest of the spine of the scapula. Table 6.1. Attachments of muscles of scapular region except deltoid. Muscle. Supraspinatus. Figure 6.3. Origin. Medial 2/3 of the supraspinous fossa of the scapula, the muscle passes as a tendon laterally beneath coracoacromial arch to blend with the capsule of shoulder joint. The tendon is separated from the arch by the subacromial bursa, figure 6.7. Insertion. Upper impression on the greater tubercle of the humerus. Number 2. Infraspinatus. Origin. Medial 2/3 of the infraspinous fossa of the scapula. Insertion. Middle impression on the greater tubercle of the humerus. Number 3. Teres minor. Origin. Upper 2/3 of the dorsal surface of the lateral border of the scapula as 2 slips. Insertion. Lowest impression on the greater tubercle of the humerus. Number 4. Subscapularis, multipinnate, figure 6.4. Origin. Medial 2/3 of the subscapular fossa. Insertion. Lesser tubercle of the humerus. Number 5. Teres major. Origin. Lower 1/3 of the dorsal surface of lateral border and inferior angle of the scapula. Insertion. Medial lip of the bicipital groove of the humerus. See figure 4.4. Table 6.2. Nerve supply and actions of muscles of scapular region except deltoid. Muscle supraspinatus. Nerve supply suprascapular nerve C5, C6. Actions. Along with other short scapular muscles, it steadies the head of the humerus during movements of the arm Its action as abductor of shoulder joint from 0 degree to 15 degree is controversial. Both supraspinatus and deltoid are involved in initiation of abduction and continuation of abduction. Infraspinatus, nerve supply. Suprascapular nerve C5, C6. Lateral rotator of arm at shoulder joint. Teres minor, nerve supply, axillary nerve C5, C6. Action same as infraspinatus. Subscapularis, nerve supply, upper and lower subscapular nerves C5, C6, medial rotator and adductor of arm. Number 5, teres major, nerve supply, lower subscapular nerve C5, C6. Actions, medial rotator, adductor and extensor of arm. The acromial part of deltoid is an example of a multipinnate muscle. Many fibers arise from 4 septa of origin that are attached above to the acromion process. The fibers converge onto 3 septa of insertion which are attached to the deltoid tuberosity. Figure 6.2. Insertion. The deltoid tuberosity of the humerus where 3 septa of insertion are attached. Nerve supply. Axillary nerve C5, C6. Actions. Number 1. The multipinnate acromial fibers are powerful abductors of the arm at the shoulder joint from beginning to 90 degree. A multipinnate arrangement allows a large number of muscle fibers to be packed into a relatively small volume. As the strength of contraction of a muscle is proportional to the number of muscle fibers present in it and not on their length, a multipinnate muscle is much stronger than other muscles having the same volume. Number 2. The anterior fibers are flexors and medial rotators of the arm. Number 3. The posterior fibers are extensors and lateral rotators of the arm. Structures under cover of the deltoid. Bones. The upper end of the humerus, the coracoid process. Muscles. Insertions of pectoralis minor on coracoid process, supraspinatus, infraspinatus, and teres minor on the greater tubercle of the humerus. Figure 6.3. Subscapularis on lesser tubercle of humerus. Figure 6.4. Pectoralis major, teres major, and latissimus dorsi on the intertubercular sulcus of the humerus. Figure 6.5. Origin of coracobrachialis and short head of biceps brachii from the coracoid process. Figure 6.5. Long head of the biceps brachii from the supraglenoid tubercle. Long head of the triceps brachii from the infraglenoid tubercle. The lateral head of the triceps brachii from the upper part of the posterior surface of the humerus. Vessels. Anterior circumflex humeral, posterior circumflex humeral. Figure 6.6. Nerve. Axillary. Figure 6.6. Joints and ligaments. Shoulder joint. Musculotendinous cuff of the shoulder. Figure 6.7. Coracoacromial ligament. Bursae. Subscapular. Infraspinatus bursae around the shoulder joint, including the subacromial or subdeltoid bursa. Figure 6.8. Dissection. Define the margins of the deltoid muscle covering the shoulder joint region. Reflect the part of the muscle arising from spine of scapula downwards. Separate the infraspinatus muscle from teres major and minor muscles which run from the anterior or the lateral scapular border towards humerus. It is lateral scapular border towards humerus. Axillary nerve accompanied with posterior circumflex humeral vessels lies on the deep aspect of the deltoid muscle. Clinical anatomy. Intramuscular injections are often given into the deltoid. They should be given in the middle of the muscle to avoid injury to the axillary nerve Figure 6.9a. If injection is given in upper part of the deltoid, axillary nerve may be damaged. The deltoid muscle is tested by asking the patient to abduct the arm against resistance applied with one hand and feeling for the contracting muscle with the other hand. Figure 6.9b. The axillary nerve may be damaged by dislocation of the shoulder or by the fracture of the surgical neck of the humerus. The effects produced are rounded contour of shoulder is lost, greater tubercle of humerus becomes prominent, figure 6.10a. Deltoid is paralyzed with loss of the power of abduction up to 90 degree at the shoulder. There is sensory loss over the lower half of the deltoid in a badge-like area called regimental badge, figure 6.10b. The tendon of the supraspinatus may undergo degeneration. This can give rise to calcification and even spontaneous rupture of the tendon. In subacromial bursitis, pressure over the deltoid below the acromion process with the arm by the side causes pain. However, when the arm is abducted, pressure over the same point causes no pain. Because the bursa disappears under the acromion process, Dauborn sign. Subacromial or subdeltoid bursitis is usually secondary to inflammation of the supraspinatus tendon. Musculotendinous cuff of the shoulder or rotator cuff. Musculotendinous cuff of the shoulder is a fibrous sheath formed by the four flattened tendons which blend with the capsule of the shoulder joint and strengthen it. The muscles which form the cuff arise from the scapula and are inserted into the lesser and greater tubercles of the humerus. They are the subscapularis, the supraspinatus, the infraspinatus, and the teres minor, figure 6.7. Their tendons, while crossing the shoulder joint, become flattened and blend with each other on one hand and with the capsule of the joint on the other hand before reaching their points of insertion. The cuff gives strength to the capsule of the shoulder joint all around except inferiorly. This explains why dislocations of the humerus occur commonly in an anterior-inferior direction. Thus, rotator cuff rests on tuberosities, fused to the capsule, strengthens the capsule, and steadies head of humerus. Subacromial bursa. Subacromial bursa is the largest bursa of the body, situated below the coracoacromial arch and the deltoid muscle. Below the bursa, there are the tendon of the supraspinatus and the greater tubercle of the humerus. Figure 6.8. The subacromial bursa is of great value in the abduction of the arm at the shoulder joint. It protects the supraspinatus tendon against friction with the acromion process. During overhead abduction, the greater tubercle of the humerus passes under the acromion process. This is facilitated by the presence of this bursa. Intermuscular spaces. Introduction. The long head of triceps brachii spans the length of the arm arising from infraglenoid tubercle of scapula to the olecranon process of ulna. It lies medial to humerus. Teres minor crosses posterior aspect of the shoulder joint and origin of the long head as it passes from its origin from scapula to the humerus. The muscle is replaced by subscapularis on the anterior aspect of shoulder joint. Teres major also crosses the long head as it runs to bicipital groove for its insertion. Thus, potential spaces are formed between lateral border of scapula, medial aspect of humerus, long head of triceps brachii, teres minor or subscapularis, and teres major muscles. In the upper part, there is a quadrangular space laterally and upper triangular space medially. In the lower part is the lower triangular space. Their boundaries are as follows. Quadrangular space, boundaries. Superior. Subscapularis in front, capsule of the shoulder joint, This is the loose inferior part of the capsule of the shoulder joint. In anatomical position, the capsule lies in this space. The capsule gets taut as it is used up during abduction of the shoulder joint. Inferior border of teres minor behind. Inferior. Superior border of teres major. Medial. Lateral border of long head of the triceps brachiae. Lateral. Surgical neck of the humerus. Contents. Axillary nerve. Figure 6.11. Posterior circumflex humeral vessels. Upper triangular space. Boundaries. Superior. Inferior border of teres minor. Lateral. Medial border of long head of the triceps brachiae. Inferior. Superior border of teres major. Contents. Circumflex scapular artery. It interrupts the origin of the teres minor and reaches the infraspinous fossa for anastomoses with the suprascapular artery and deep branch of transverse cervical artery. Lower triangular space. It is diagonally opposite the upper triangular space. Boundaries. Medial. Lateral border of long head of the triceps brachiae. Lateral. Medial border of humerus. Superior. Lower border of teres major. Figure 6.11. Contents. Radial nerve. Profunda brachiae vessels. Dissection. The quadrangular intermuscular space is a space in between the scapular muscles. The quadrangular space is bounded by teres minor above and teres major below, by the long head of triceps muscle medially and the surgical neck of humerus laterally. The axillary nerve, accompanied with posterior circumflex humeral vessels, lie in this space. Identify the nerve to the teres minor muscle. Identify part of the capsule of the shoulder joint. Another intermuscular space, the upper triangular space, should be dissected. It is bounded by the teres minor muscle medially, long head of triceps laterally, and teres major muscle below. Now the remaining 2/3 of deltoid muscle can be reflected towards its insertion. Identify subscapularis muscle anteriorly. Define the attachments of infraspinatus and cut muscles at the neck of scapula and reflect it on both sides. Look for the structures covered with deltoid muscle. Identify a lower triangular space which is bounded above by the lower border of teres major muscle, medially by the long head of triceps brachiae, and laterally by the medial border of humerus. The radial nerve and profunda brachiae vessels pass through the space. Dissect and identify the arteries taking part in the anastomosis around scapula. These are suprascapular along upper border, deep branch of transverse cervical, which is dorsal scapular, along medial border, and circumflex scapular along lateral border of scapula. Figure 6.12. Axillary or circumflex nerve. Axillary or circumflex nerve is an important nerve because it supplies the deltoid muscle, which is the main abductor of the arm. Surgically, it is important because it is commonly involved in dislocations of the shoulder and in fractures of the surgical neck of the humerus. The axillary nerve is a smaller terminal branch of the posterior cord of the brachial plexus C5, C6. Root value. Its root value is ventral rami of cervical 5, 6 segments of spinal cord. See figure 4.14. Course. Axillary nerve courses through lower part of axilla into the quadrangular space where it terminates by dividing into two branches. Figure 6.6. Relations and branches. A part. In the lower part of axilla, the nerve runs downwards behind the third part of the axillary artery. Here, it lies on the subscapularis muscle. It is related medially to the radial nerve and laterally to the coracobrachialis. See figure 4.9. The nerve leaves the axilla by winding round the lower border of the subscapularis in close relation to the lowest part of the capsule of the shoulder joint, where it gives a branch to the capsule of the joint and enters the quadrangular space. Figure 6.8. The nerve then passes backwards through the quadrangular space. Here it is accompanied by the posterior circumflex humeral vessels and has the following relations. Figure 6.11. Superiorly, subscapularis anteriorly or teres minor posteriorly. Lowest part of the capsule of the shoulder joint. Laterally, surgical neck of humerus. Inferiorly, teres major. Medially, long head of the triceps brachiae. In the quadrangular space, the nerve divides into anterior and posterior branches. Figure 6.6. The anterior branch is accompanied by the posterior circumflex humeral vessels. It winds around the surgical neck of the humerus, deep to the deltoid muscle, supplying the deltoid and the skin over its anterior inferior part. The posterior branch supplies the teres minor and the posterior part of the deltoid. The nerve to the teres minor bears a pseudoganglion, that is, fibrous tissue and fat without any neurons. The posterior branch then pursues the deep fascia at the lower part of the posterior border of the deltoid and continues as the upper lateral cutaneous nerve of the arm. Its clinical anatomy has been given on page 77. Anastomosis around scapula. Anastomosis around the body of the scapula. The anastomosis occurs in the three fossae: subscapular, supraspinous, and infraspinous. It is formed by the suprascapular artery, a branch of the thyrocervical trunk, figure 6.12, the deep branch of the transverse cervical artery, another branch of the thyrocervical trunk, the circumflex scapular artery, a branch of the subscapular artery which arises from the third part of the axillary artery. Note that it is the anastomosis between branches of the first part of the subclavian artery and the branches of the third part of the axillary artery. These arteries also anastomose with intercostal arteries. Anastomosis over the acromion process. It is formed by the acromial branch of the thoracoacromial artery, second part of axillary, the acromial branch of the suprascapular artery, first part of the subclavian, the acromial branch of the posterior circumflex humeral artery, third part of axillary. Note that this is the anastomosis between the first part of the subclavian artery and the branches of the second and third parts of the axillary artery. Figure 6.12. Clinical anatomy. The arterial anastomosis provide a collateral circulation through which blood can flow to the limb when the distal part of the subclavian artery or the proximal part of the axillary artery is blocked. Fracture of middle one-third of humerus causes injury to radial nerve as it lies in lower triangular space. This results in wrist drop. Facts to remember. Branches of axillary nerve with accompanying blood vessels pass through the quadrangular intermuscular space. Loose fold of capsule of shoulder joint forms upper boundary of the quadrangular intermuscular space. Radial nerve and profunda brachiae vessels course through the lower triangular intermuscular space. Only circumflex scapular vessels pass through the upper triangular space. Long head of triceps brachiae is placed between quadrangular and upper triangular spaces. Lower down, it forms a boundary of lower triangular space. Clinico-anatomical problem. A patient came with injury on left shoulder region after an accident. He was not able to abduct his shoulder joint. Which nerve is injured? Where is the sensory loss? Due to the injury to the surgical neck of humerus, the axillary nerve got damaged. Patient feels inability to abduct the shoulder joint. The sensory loss is over the lower half of deltoid muscle and is called regimental badge area due to injury to upper lateral cutaneous nerve of the arm, a branch of the axillary nerve. So this was scapular region.